We move now to another health question. Dr. Christopher Labos is a cardiologist with a degree in epidemiology, and you can hear him Sunday mornings on CJAD 800 with Ken, on Weekends with Ken at 8 to 10. Now, we talked to him a couple days ago about NACI, the National Advisory Committee, on immunization, doing an update on COVID booster shots and vaccines in general. And over the last couple of days, certain concern coming out over what some people are calling COVID complacency, wondering if you are perhaps getting a little too comfortable. Maybe you've forgotten when your last booster shot was. Will you be ready to get it in the fall? Dr. Christopher Labos joins us on the line. Hello, Dr. Labos.
Hello.
Does the words COVID complacency scare you?
Yeah, a little bit, because our biggest threat now is not so much the virus, but our own complacency, because we're in a very difficult situation. Because at the beginning of the pandemic, everybody was scared. Everybody was scared they were going to die because there were so many unknowns, there were so many uncertainties. Now we're in a different situation. A lot of people have been vaccinated. Many people have had COVID and have recovered. And so a lot of people think COVID is no longer a big deal because they approach it from the point of view of, well, I'm going to be okay. I'm going to recover. I'm probably not going to die. And, we're not really having a conversation in the sense of the burden that COVID is going to put on our healthcare system, and the burden it already has put on our healthcare system, quite frankly. And so going forward, if we have a repeat of what we had last fall, because people forget last fall was really bad when you had COVID, influenza, and RSV circulating, and the shortage of pediatric fever medications, and a number of stuff happening simultaneously. We could face a difficult time, not in the sense of, people dying in the streets, but in a sense of a lot of people getting sick, hospitals being overwhelmed, and you having difficulty accessing medical care, which is a problem that more and more people are facing. And so when you try to explain to people that this is still an issue, this is still a problem, it's sometimes hard to make the distinction between it's not necessarily a danger for you as an individual, it's a danger for the system as a whole, and that it creates more and more backlogs and makes it harder for you to access medical care when you actually need it.
Dr. Labos, I'm glad that you brought us back to last fall and a reminder of what things were like back then, because along with COVID, we had, of course, influenza, which is cyclical, which comes back every fall. And you reminded me, I'd actually forgotten that we did have that medication shortage, and specifically children's medication was really difficult to find at that time. Are we heading towards something like that again? And is this going to be the new reality that every fall we're going to, need our new COVID vaccination?
Probably, but we don't really know. There's still things that we are figuring out. Now, here's the thing. Most respiratory viruses surge in the winter. And even before the pandemic, hospitals were strained during the winter months. The flu season, especially when it was a bad flu season, it put a lot of strain on the healthcare system. Emergency rooms would get more crowded during the winter because of all the people who got sick and went to the emergency room. And if you ever had to call the hospital during the winter, they would often say, they would have some sort of automated message. It's flu season. If you're feeling unwell, please don't come to the emergency room if it's a minor illness. So this was a problem even before the pandemic. The pandemic just sort of made it worse and exposed a lot of the problems. So now we don't know if COVID is going to have the same type of cyclical pattern that we see with influenza. We're sort of assuming it will, but it hasn't really followed the typical seasonal pattern that we would expect of most viruses. So will there be a surge in the fall and the winter? Most people are assuming there will be. We don't know how big a surge it's going to be or how significant it's going to be. And we don't know if it's going to keep happening. We're sort of assuming it's going to do that. But if we have repetitive cycles of influenza, COVID, RSV, and everything else, and if there are very bad years where we have more virulent strains of influenza, COVID, and RSV, or what have you, then that is going to be a problem, and we're going to have to take measures to stop that, one of them being vaccinations, as we vaccinate against influenza, and as we are probably going to start vaccinating against RSV once the RSV vaccine gets approved. So that is one measure, but we're going to have to do other stuff, and there are other infection control measures that we need to start thinking about, and especially during cold and flu season, people staying home when they're sick is going to be important. The other problem with complacency, you have a lot of people showing up places like, oh, it's just a cold. I'm like, well, it probably isn't just a cold, but even if it is just a cold, don't go and infect other people. Making other people sick is not a testament to your strength and hardiness. It's just making other people sick, and that's not a good thing.
Yeah, the old, it's just a cold, don't worry about it. I don't think anybody's happy to hear that being said. So now you've alluded to some other measures. Of course, we're talking about vaccination and the idea of getting a booster shot for the fall and winter months. Are you thinking that we're going to be back to wearing masks and potentially going back into isolation?
Well, I mean, I very much doubt the government is going to do any, lockdown procedures. There's no political appetite for it. I suspect that's not going to happen. I mean, here's the thing, though. Wearing a mask, especially if you're going to be in a, confined indoor space, you're less likely to get sick. I mean, if you ever had a stranger sneeze on you when you're on the subway, you understand how easy it is for diseases to spread, especially during the winter months. And there are parts of the world where people wear masks on public transport all the time, and that's just completely normal. So I think we're going to have to acknowledge, look, you have to decide if you want to get sick again. I think most people experience the reality that they didn't get sick when they were, wearing masks in public and not, going out into public spaces like that. So if you don't want to get sick, and getting sick is not fun, even if you survive the episode, wearing a mask in those settings makes a big difference. Now, if we want to get away from wearing masks because, it offends our sensibilities or what have you, there are other things that we can do to prevent infections in public spaces. There are, first of all, air filters, cleaning the air, HEPA filters, and upgrading the status of our buildings. The same sort of discussion that we had with schools, we have to start thinking about that in our other public spaces, all our other public buildings, our offices, our places of business. And if we don't want to do air filtration, there are other technologies for cleaning the air, like UVC lights and far UV technology to disinfect the air. So there are things that we can do, but we have to have that conversation, and we have to acknowledge that it comes with a certain capital investment, and we can't shy away from that because there's a cost to people being sick. Every time you're sick and you miss work, that is a loss of productivity that costs the healthcare system and the economy as a whole a significant amount of money. So, when somebody bristles at the cost of buying an air filter that costs $200, you have to think, how much does it cost you when you're off work for 5 days because you're feeling sick?
Dr. Christopher Labos, I'm sure this will not be the last word on the COVID booster. We'll check in with that, I'm sure, a little later on. Thank you so much for your time.
My pleasure. Take care.